All right, so we'll jump in.
All right.
All right. So here we are with the third installment of Save Nuts podcast, Go Nuts. I'm joined here today by my good friend, Mr. Garrett Logan. He has been gracious enough to come on and answer a few questions in the midst of this pandemic. Garrett is a nurse that is working on the front lines for us, and we thank you and everyone else who is really just putting themselves in that kind of harm's way for our betterment. So thanks for joining us, and I hope you are comfy at home and ready for this stimulating discussion.
Thanks for having me. Absolutely. I'm excited.
Awesome. So what's the workspace looking like there before I jump too far in? Where you got yourself stationed in the house?
I am sitting in the dining room, actually at my fiance's work desk, which is more or less taking over our dining room table.
Nice. So obviously she is also accommodating herself at home, as a lot of us are.
Yeah, I get a little stir crazy like everybody else in the world right now, but yeah.
I imagine. And obviously, as you said before our meeting, hopefully no disruptions from the dogs, but I think that's pretty common for everyone nowadays.
Well, we'll cross our fingers for that one.
Fair enough. So I just want to dive in a little bit, talk about obviously what you've been doing. So why don't you give us a little insight into exactly your role as a nurse and kind of what you've experienced so far?
So, like you stated earlier, I work as a nurse. I actually work in an area emergency department, specifically over toward Cabarrus County, Concord location. Despite the pandemic, despite anything else, I would always kind of classify my work as the front line. We are the first responders. When someone goes to the hospital, you hear somebody say like, "Oh, I have to go to the hospital," or something happens and they have to go to the hospital. We are the frontliners because we're the first ones who actually come into contact with these patients, and we have to kind of like decide, what's going to be the course of action. Is it going to be like a treatment discharge, treatment admission? So like anytime something like this health pandemic happens out in the community, like we're the first ones coming in contact with it. And that's something that's always kind of like scary to think about and freaky to think about. But at the same time, like the response to everything going out has been really, really well. I think that the team I work with is fantastic. The guys I work with or the guys and girls at my work that I work with, they're great. Teamwork is, we've been killing it the past couple of weeks.
Awesome. And is it typically the same group of people, or is it a rotating a group based off of this?
So it's typically the same people. Strangely enough, except for emergency departments, you've actually seen a lot of nurses in the area like furloughed or losing hours because as it's becoming more and more dangerous to go out in public and interact with others, it's also getting more dangerous to go to the hospital. And I think it's kind of deterring people from going to the hospital. So like we as an emergency department, we're still, we're still working to the end of the shift, but in other areas, I know of several areas in my hospital that have actually closed down because when there's less people coming in the hospital, there's less people to take care of. So they're shutting down in order to actually keep the hospital operating.
Wow. Okay. And just out of curiosity, what sections in particular have you seen a slowdown because there's less people now coming in?
So, one big, probably the largest like patient population that you have in a hospital is like med surg or medical surgical. You see a lot of like inpatient admissions from the emergency department. A lot of those go to med surg floors because that's the most common floor there is in the hospital. Now, typically med surg floors actually take care of specific ailments. So like you have like your cardiac floors, you have your neurologic floors. And it's not necessarily like they're specific. But one unit that I know of is like our observation unit. Typically, when you get admitted to the hospital, you are either classified as observation or inpatient. Observation meaning you're probably only going to be here 24 to 48 hours. And the only reason you're actually coming into the hospital is to have a couple of tests run that would take too long for you to sit in the emergency department. So it's kind of like an extension of the emergency department in a way.
Okay.
That floor has actually not had any patients for a couple weeks now, just because it's like, you can do that on any floor, but you can't do every single thing. Like you can't run an ICU on the observation floor.
Right. Okay. Wow. So we've seen though, because of what you said is possibly people just kind of more nervous about coming in contact and being in areas like a hospital, that it's actually closed down or at least put kind of a delay in kind of those departments itself.
Yeah, absolutely. I mean, those workers, you know, they're not necessarily fired or furloughed, but they've also, I will say that like they are actually being floated to other units. So it's not only that like they're losing out on hours, but they're also being somewhat taken out of their comfort zone because they're not used to working with the kind of patients that they're having to go deal with now. Uh,
Sure.
I mean, from one end of the perspective, you know, it's like you're being taken out of your comfort zone working with stuff you've never done before, but at the same time, they're getting a lot of experience working with those other kind of patients.
Right. And in that way, I would imagine that's a good thing. It almost, it's, extending their knowledge, is extending their areas of expertise that they can go work. Have you ever noticed though, where because maybe someone comes in from one of those other departments and now they're trying to hop into maybe one such as your own, that it sometimes does throw a little ripple or a little possible issue just because you're having to kind of teach them on the fly while they're in a
Yeah.
new section?
So at the hospital system I work at, we've actually been given the option to sign what's called a redeployment commitment.
Okay.
So if you have been affected by losing hours due to like our lower census or lower patient population in the hospital, you got to sign this redeployment commitment that was put on by the company. And what it does is it allows you to say, I got called off for 8 hours of a shift last week. Instead of burning up my PTO, my paid time off, in order to make up for those 8 hours and still get paid, what I would do is I would sign this redeployment commitment. And later on in the week, if there was another unit that actually needed help, but they didn't have anybody to call, I would be on that list of people to call for 8 hours. And it would give me
Okay.
that chance to make up that 8 hours. And if because I signed the redeployment commitment, because I made that commitment, the reward is if nobody needs me, I will still get paid for that 8 hours and not have to use my PTO. So we've seen a lot of redeployed nurses from upstairs come down to the emergency department where I work and actually kind of like get their tours and kind of understand how the flow of things happens, where things are, because an emergency department does not operate the same as an inpatient floor. There are multiple levels to an emergency department. You've got, I mean, anywhere from your cardiac arrests to your severe traumas to, I mean, your psych. I mean,
Right.
it's a broad spectrum, and that's the thing about an emergency department. You don't get one specific thing like you do on the floor. You get it all. So we've had a lot of people come down to like kind of get a feel for it and kind of understand, like, you know, should it hit the fan, you know, like they're going to need more help down here, and they're having to learn how the flow operates. Charting systems for nurses and CNAs between inpatient floors and emergency department, it's completely different. It's a completely different charting system. So like we're having to teach them how to do that as well.
Wow. Okay. Yeah, it's something I don't think, I just speaking from my own perspective, I would have never have thought of is, how specified, someone in that field would have to be in, for nursing to be able to go from one floor to another and kind of that learning curve to bring them back up to speed.
Yeah,
But it's also a little comforting, I guess, because now you feel like, as time goes on, they're becoming more integrated. There means there's more qualified nurses, more people that can be all hands on for, situations
absolutely.
such as this.
And honestly, I mean, absolutely. I mean, I'm grateful that they have the chance to come down here. I mean, honestly, I used to work inpatient. I used to work up on the floor, and it's a completely different world than down in the emergency department. And I think everybody should have the chance to have this opportunity for education, or this to like really get your feet wet in in an area that makes you almost uncomfortable, because I mean, I've never worked any job like an emergency department nursing position. It's wild.
I have had many of times heard your stories about before all of this has happened, how crazy it is there. And some of them, I sit there and I start to turn myself a little bit, try and get my stomach out of a knot going, this is what you do. I can never imagine myself being in that situation. So for beyond even just this scope, I am so glad there are people like yourself who can go in and tackle that type of work, because I do not have the stomach for it. I am way too weak to do that.
I mean, and I'm not trying to toot my own horn and pardon my language, but it does take a specific type of badass to be able to just like walk in there and just take on head on whatever comes through that door. But at the same time, and again, I'm not trying to like speak like up myself or gas myself up in any way, but like I get nervous walking in because I don't know what I'm walking into, and
Right. Yeah.
that's the way it is working in an emergency department.
So that kind of brings me to the next thing I would like to cover with that is we know now that there are new people jumping in, but the flow has been pretty much the same. But what is kind of like your protocol now? Because obviously life goes on, other things other than this disease that's come in has happened. How has that affected the ER in itself? I mean, I know you guys are still covering, but like, is there new protocols, new situational awareness that they have to teach you, things to do?
So prior to all this, and I don't know like what everyone's experience going to an emergency department. I'm sure everybody has had some level of experience, whether it be a good experience or bad. But I would say that our census has actually come down. Like the amount of patients that we get has come down, but the people who are coming in are legitimately sick. Even in a global health pandemic, even with all this stuff going on in the community, emergencies don't stop happening.
Right.
So now, just like any other hospital story that you hear, or any other like news article that you hear, we are running low on personal protective equipment, PPE. We are running low on it. And that's just a sad reality of where we're at. I will say that we've been blessed to not completely run out. We are doing the best that we can to conserve. But there have been some like procedures that have changed, including like the triage process. Typically, when you come into an emergency department, you get triaged, which is basically you go and see a provider and a nurse right away, and you get your complaint taken down. They get your vitals, and then from there you are graded on an emergency severity index, and that just like basically decides like how fast are you going to be seen. So it basically lets us have the ability to say like, okay, well, chest pain is more important than a broken toe.
It's a prioritizing based off of when someone comes in.
Exactly. Okay. So that process has always existed in an emergency department, but now the hospital that I work for, we have now implemented new visitation restrictions. No visitors are allowed in the hospital, which I would imagine is absolutely difficult on family members. No visitors are allowed. If you want to be here with your family, you have to sit in the waiting room. When you come in, whether you are a patient, a staff member, or a visitor or family member, you get screened at the door. You get asked a list of questions. Have you been experiencing this, like fever, loss of taste or smell, basically running through COVID-19 symptoms? If you meet any of those requirements, you're not allowed in if you're a visitor. If you're a worker, you're not allowed in. If you're a patient, you automatically get taken back to the department. You skip the triage process altogether, because the idea is rather than have you sitting out in the waiting room to be triaged amongst all these other people who are potentially patients, you could potentially get them sick. So we don't want you sitting there incubating with the other patients. So like we automatically take you back to a room with a closed door. And I will say that interestingly enough, our EMSs, our ambulance personnel, our ambulance staff, and our ambulance patients, they're all being screened as well. So as they're coming through the ambulance bay, they are not allowed to just simply badge in and come in now. They have to be met out there with a staff member, and they have to screen every EMS personnel and every EMS patient. And everybody gets a mask. I mean, it's definitely slowed flow down a little bit, but we're doing it in every chance we can just to ensure protection for our staff and our patients.
I'm sure. I mean, I can imagine having to take a moment each time someone tries to walk through the door and asking them to go through these list of questions, possible symptoms. That's going to take time for anyone to list that out before getting back there. Do you think there's any possibility that there are some who could be trying to take advantage of that, knowing that if I say I maybe have these symptoms that I could get rushed back there?
So yes and no, because to be completely honest with you, as more testing rolls out, we're seeing that, testing is becoming more available, whereas when all of this started, it was nowhere near as available as it is today. it's not going to work well for you if you're just trying to use it to bypass the weight, because you're going to get a cotton swab shoved up your nose, and it's not pleasant. I've done it to plenty of people. I will say that if you check off any of those lists and they do rush you back, I mean, your care is delayed, because unless it's like a respiratory distress where someone can literally not breathe, we're having to take as much precaution as we can. And again, ensuring your safety, loved one's safety, and staff safety, because if we get sick, we can't take care of you.
Right.
So we can't enter the room without full PPE on, and that takes at least 1.5 to 2 minutes to do. We have to do what's a practice called cluster care, where I basically have to wait until a doctor sees you and they put in all of your orders, and I have to get everything done all at once. Your IV, meds, labs, blood work, everything. I have to do it all at once, because we have to prevent ourselves from opening the door to your room as little as possible, so that we don't aerosolize the rest of the department.
Right.
It's challenging.
Yeah, I imagine. I mean, like I said, I mean, it sounds like something that definitely takes extra time and extra steps that normally you wouldn't have to account for.
Absolutely.
Do you think this is a procedure that would kind of be something that would be more common moving forward, even after the initial restrictions are lifted?
So the way I see it is, government restrictions do not stop anything. Government restrictions are not going to stop you from leaving your house. Government restrictions are not going to slow down a virus. It's not like the COVID-19's floating around the air and it's like, oh, well, the governor said that they can go outside, so I'm going to dial it back a little bit. That's not how it works.
Sure.
So I think just like the flu, which comes back every year, I don't know how this is going to go. We haven't seen it for more than 1 year. There are some models that suggest it will come back. There are some models that suggest that once it gets warmer that it'll dissipate completely. We just don't know. We don't have enough information. And so I believe that it's very possible that this could, like these precautions that we're having to take, could very well go on for a while.
Okay. So this is one where we're going to have to gear up as information comes in.
Yeah.
Okay. And so with your, I guess, day-to-day now too, I know I'm taking a little bit of a step back because I feel like we covered a lot of your new protocols that have come in. You know, how does this affect, just in your own opinion, your day-to-day, kind of getting yourself prepped and kind of getting yourself ready for work? Does it, step me through that a little bit?
At my emergency department, so with all the new precautions and things like that, one big thing, and again, this is having to do with the hospitals themselves. We're losing a lot of revenue. The hospitals are, and it's because most hospitals nationwide have actually canceled elective procedures, which is where a lot of hospitals make their revenue, make their money. So elective procedures are on hold as of right now. So the people who can afford to pay for surgery, the people who are coming in to get those elective procedures done, that don't necessarily, it's not an emergency, it's something that you're just willing to do, or want to have done. We're putting those on hold because we don't want to risk more spread and more disease. And so as we're losing that revenue, we're having to shut down departments. Some nurses are being let go or furloughed until all of this passes. Other staff members are the same way. With those elective surgeries being canceled, we're actually have been blessed with the opportunity to have hospital scrubs that we have to wear. So one big thing that I've seen in my day-to-day, like in terms of like getting ready for work, is I no longer wear scrubs to work. I just go in, what I'm wearing now, and I go to the locker room, I get a size of scrubs that fit me, and I change in the locker room. And then I change back into my clothes before I go home, and then I come home. But the big challenging thing is like, I don't want to come home and spread it to my family or my fiance who I live with.
Right.
So sorry for all the listeners out there, but I get naked in my garage before coming in the house, man. I straight up, I strip in the garage and I come immediately straight in and I put my clothes in the washer for a warm wash, because I just do not want to risk spreading this, no matter how much PPE I had on or how much precaution I took. You never know.
Yeah, I don't blame you for that one, and I'm sure your fiance is very happy with that decision. What kind of conversations did you guys have as this was moving forward about, hey, there's the stay at home, and obviously I'm going to be subjected to being face to face with this. What did you guys try and do to kind of realize, okay, this is what we have to do as precautions, even amongst living with one another?
So, again, making sure that my clothes that I went to work in, even though I didn't work in them, I went to work with them, ensuring that they get washed immediately. As soon as I come in, I start that wash and I immediately hit the shower. I hardly say 3 words to her. I'm like, hey, babe, shower. And then there have been several times where we've talked and she's gotten either emotional or scared because she doesn't know what I'm walking into. And it's understandable. I don't know what I'm walking into either. And in terms of hospital staff getting sick or hospital staff putting themselves at risk, working on the front lines and in an emergency department, I'm the first one at risk. So it's definitely a scary situation. And our families are very much at risk too, but it's something that needs to be done. If I'm not going to do it, somebody else is. And it's just got to be done. People don't stop getting sick just because you're sick with this stuff. It doesn't mean that you can't be cared for. It doesn't mean that you can't get your symptoms, treated. We're going to do what we can. But in terms of like our conversations, it's just we put these precautions in place and we try to limit our exposure to the community as much as possible, not only for their safety but for ours.
Yeah, I'm sure, and I'm sure all of those are not easy conversations to have with family members and with your fiance who you're living with,
and my friends,
and of course, and us. We're all scared and we're all thinking about you because we know what you're faced with and what task you have. I can't imagine. Is it something that was? I guess is it a normal kind of like day-to-day, week-to-week update that you kind of communicate with your family and loved ones, to kind of say, hey, this is where we're at, this is what I'm seeing? Is it kind of that kind of communication, or is it, off and on?
So, I mean, for the most part, it's obviously changed. The attitudes changed because, when all this first started, started out in another country, we didn't know how it was going to go. All the memes were spreading, like we were making jokes about it, but then it started popping up in the US and, it was instant, a conversation was going to completely change, and it has completely changed like so many times because the severity of the situation has gotten worse and worse. I try to update my family as much as possible, especially my parents and my brothers who are living together at home. I usually try to talk to them either every other day or every couple of days just to let them know, I'm all right, or everything's looking okay. It's difficult just because, I don't get to see my family that much anyways, just because they live about an hour and a half from me to begin with. But it's been difficult just not being able to see my family in general. And I'm not the only one suffering from this. Everybody is. Right. My fiance, we live 10 minutes from her mother, and she hasn't been able to see her for the same amount of time. And it's been difficult.
It's a weird situation. I know my family's not far from me, but we've been distancing ourselves, and I've got a mom who is always wanting to try and see me, and so she's trying to get creative. I don't know if you'd think, but she wants to do these dinners now where she literally sits the chairs in a position and then has taped out measuring tape 6 feet and just puts down an X and goes 6 feet, 6 feet, 6 feet.
What does your dad have to say about this?
I think he's smart enough to know that if he criticizes her, he's going to get a dirty look and he's in the doghouse. So I think he just smiles and goes, you keep on going, honey, keep on doing what you're doing. So it does. It affects all of us. So I completely know what you mean. It's an unprecedented time to have to sit there and say, hey, I know we're an hour away or 30 minutes away, but I still, can't find a way to really come see you at the moment. That's why we're so thankful for things like Zoom. I mean, without this, I think I can speak for myself. I'd be going mad. There would be no socializing at all. So is this kind of like something that you've been using for helping, if you will, your socializing, your mental relief, your ability to stay sane while in quarantine?
So, well, I'm sure you know all too well. There have been some really great apps come out since all of this started to basically let people still be able to socialize. There's There's Zoom, which has been heavily popularized amongst a lot of people, especially for like those working from home and stuff like that. But one of my favorites is definitely House Party.
Yeah.
That's a lot of fun, and that's something that you and I both have experience with. And
Lots of experience at this point.
and then I've always been, like, funny enough, a lot of my closest friends, with you and everyone else here and around here included, one of my biggest hobbies prior to all this was video gaming. And so with like video gaming nowadays, you can talk to anybody anywhere. And I've been using that a lot to keep in touch with a lot of my friends who not only live here, but live out of town, like back where I'm from, or even further away. We've been able to kind of keep in contact. And I think that's been very helpful. And it's also kept me in the house.
Sure. Yeah. It keeps you safe, gives you something to do, not having to worry about it. Yeah. It's definitely something that I think a lot of us have done. And I know for myself, I've been more prone now to, kind of looking into different shows maybe that I haven't been wanting to watch, or different games that I never would have looked into beforehand. So there's been some things, to keep yourself a little bit occupied and not so much fixated on the fact that you're forced to stay at home as a precaution. So I can imagine. So now I have to ask, because I'm sure at some point she has asked, or she's mentioned, at home projects. Have you had any of those pop up? Have you worked on any?
Yes. I'm not going to tell you now, because my bedroom is a huge mess. I'm not going to show you now, especially for the internet to see. But I've put together a new bed set, new bedside tables. I just finished up a 6-drawer cabinet to go in our bedroom like 2 days ago. And we've also been working on wedding decorations.
Okay. Yeah. Now, I didn't want to bring up too much of it, but because you brought that up, how is that with that date slowly approaching? What are your guys' thoughts? I mean, obviously, first, congrats, but, you're coming up on that date. Is that kind of giving you any pause? Because this whole thing?
We have had a few minor discussions regarding that. I will say that we kind of cut those short just because it makes both of us incredibly upset. We're not the only people that have been affected, like wedding wise, by all of this crap going on. And it's a heartbreaker. It's something that you only do. For most people, they plan on only doing it once in a lifetime. And it's definitely something that's challenging to talk about, but we have had some conversations. But I have told her, if it comes down to it, the date we set, I am marrying her on that date. I don't care if I have to ordain a friend and we do it in my backyard. I'm marrying her on that date, and everything else can be put on hold. But just all the planning and everything that goes into it, it's scary to think that all that hard work would go to waste when not all of this. I mean, like, this wouldn't completely have passed, and it's something that we just have to play by ear as time goes on.
Right. Yeah, I didn't want you to have to go too far into it, but I kind of thought about that as, it's an approaching, event that unfortunately is not that far out. But it's definitely one that still, you guys should be excited about. And I hope you are obviously still thinking, maybe, if nothing else, creative ways in which we could, get to celebrate that day with you guys.
Absolutely.
Awesome.
I'm excited. Regardless, it's going to be great. But I just hope it all goes as planned. And if not, then that's our destiny. So.
Well, hey, if nothing else, if it does come to it, and it unfortunately is something that gets a little bit change up, if you will, on it, at least maybe it's a hell of a story to tell later on in life.
Absolutely.
Hey, we got married in the midst of a pandemic.
We were wearing masks at the altar.
Wearing masks at the altar. Everyone, we took a whole line of chairs, and it was just everyone on a Zoom call, all facing us at the altar.
Oh, yeah.
So, yeah, there's things to do there. So if there's something that you would say for those of us at home that you would recommend us do, and not just for ourselves, but also for individuals like yourself, what are some things that we could do to help, frontliners and show our support in ways that, won't compromise, either party, but that we could show our appreciation?
Um, the only thing that I have is controversial, but
Okay.
it's stay at home.
Okay.
There's people who, there are protests breaking out. There are people who are, protesting that the government open back up when it never really closed to begin with. People are saying, like all of these laws. There's been no law stating that you have to stay at home. You are free to do as you please, but the purpose of stay-at-home orders from governments or state governments across the nation is to basically alleviate the burden of patients on healthcare systems. And to be completely honest with you, I feel that if things are done prematurely, the hard work that we've put into keeping this virus at bay, keeping this pandemic where it's at, it's still increasing, it's still going up every day. There is no sign of slowing down whatsoever. But if we start slowly reopening back up with all of this work that we've done so far, I feel like it's going to go to waste. The best way for me to relate it in the field that I work in is when you go to the doctor and you're sick and you get prescribed an antibiotic, you are told to take the whole thing. Even if you already feel better, you take the whole prescription. This is basically the equivalent of that. We are going to be reopening and people are going to be going out and socializing and going out in public and stuff before they finish their prescription. And it's not going to get any better. In fact, it may very well get much, much worse. And so I think the biggest thing that you can do, and I don't want to thank you. I'm not deserving of anything. This is what I signed up for. But I think the biggest thing that you could do for all of your loved ones, all of your friends, and all of the hard workers that are in the healthcare system, the healthcare setting, working their asses off every day to make sure that you guys stay healthy and that you're treated when you come in, is stay at home, because if not, you could very well overcrowd the system, and we're going to see a lot more turmoil from all this.
Okay. And I think that's a perfectly reasonable request, I think, of us. I think if you're willing to be out there faced with it heads on, I think I can stay at home and sip on my coffee and throw on some Netflix.
I hate that. Okay, I hate this. I am the number one on the top of the list. Like, please let this be over, because I want to hang out with my boys. You're one of them. I mean, I want to hang out with my friends, but at the same time, it's not safe. And with where I work, there are people who are positive, who are asymptomatic. Literally anybody you could come in contact with could have it. And that's what's scary. And that's why even when all of this reopens, even when everything goes back to normal, but we're still seeing these cases come up, you're still not going to see me, because I am still very much at risk of not necessarily at risk of getting sick, but getting others sick.
And I feel like that's something right now that a lot of people are torn on, is, having some of these restrictions lifted, but trying to find the correct guidance on, is it really smart to go out? Like, technically, yes, you're being told restrictions are lifted, but, I know for myself, in the back of my head, I'm thinking, okay, yes, I know they're restricted, but, I don't know how much I trust going out here yet into normal social activities. I just don't know where we're at yet. And I don't feel confident enough to say, yeah, okay, I'm okay with this threat being diminished and I think I can go out. I think that's resonated probably with a lot of people. I don't think that's just a singular or a minority opinion. I think a lot of people are trying to figure that out for themselves. So I think that's a good message that we can still spread. I think, anything that you can pass on, and if it's just stay at home, I'm going to take that very seriously. You are much more qualified than I am to be able to tell me you should stay at home.
I'd rather you be at home safe than out potentially getting sick.
Yeah, and that's the whole reason. Like you said, the whole basis of this was to make sure that we can try and find a way to limit that curve of how many people are sick, and to make sure that we try and end this as fast as possible while being smart.
It's not forever. It's temporary.
Yeah.
I got so many video games to play. It's stupid. So I'm going to be sitting here playing them.
Right? I mean, hey, if we got to stay at home, might as well.
Exactly.
Oh man. Oh my goodness. Oh, this stuff has got to end.
I know it's rough, and it will end. It will end.
Yeah, and I guess that's the key. We just got to keep telling ourselves, eventually this will be over. We'll all be better for it. We'll be safe and healthy, and we'll just we'll move on with life from there. Well, I appreciate all your time, and again all of your efforts that you've been out there on the front lines helping us, and for, like I said before, all of those people who are doing that. I appreciate your insight, and hopefully we will be seeing each other not too far from now, but we'll wait, especially after the please stay at home comment. Yeah, okay, that might be a little bit, but like you said, there's house party, there's Zoom, there's video games, there's all kinds of stuff that we can use to still be social. But yeah, just wanted to extend that out there, and you again, thanks for sitting down with us and giving us some good insight into.
Yeah, absolutely, it was my pleasure. I'm happy to be helpful. It was good to see you guys. I miss you guys a lot, and I can't wait for this to be over so we can hang out.
Absolutely. As soon as it's over, I think we will have to have ourselves some form of, I guess, dehibernation.
A pandemic party, if you will.
There you go. Well, not a pandemic party. What would we call it now?
Liberation celebration.
There we go. I'm going to go with that one. A liberation celebration. I think that would be what I would mark on my calendar.
There we go.
That's fantastic. So thank you for that time. We're hopefully going to have this up here soon on the YouTube channel, Spotify channel, so you guys can all check it out on Go Nuts and for Save a Nut. And if you want to follow the content, go check us out on Instagram or saveanut.org, where you can find any of our social media threads. And then until next time, we'll see you guys for a fourth installment. But again, thanks, Garrett.
Yeah,
and
man.
We hope to see you soon. Stay safe.
Yeah, man.
Bye, bud.
Bye, bud.
Yes, that was dope.
Yeah.
Everything was dope.
All right.